Hi everybody, my name is Guillermo Coronel and today we are going to talk about abortion, quality care and public health implications. An abortion is when the pregnancy is ended so that it does not result in the birth of a child. Sometimes this is called termination of pregnancy. Abortion is a common experience for reproductively aged women around the world. Around the world, 43.8 million abortions were done in 2008, representing one-fifth of all pregnancies. Abortion is safe and has lower morbidity and mortality than childbirth when carried out by trained practitioners in sanitary conditions, but nearly half of the abortions done in the world are unsafe according to the WHO definition. Now we are going to see a video.
Women in all parts of the world have abortions, and they have them for similar reasons. Where it is illegal, many women still resort to abortion, even when that means breaking the law. In fact, there is little relationship between the legal status of abortion and how often it occurs. Some of the highest abortion rates in the world are in Latin America and Africa, where abortion is highly restricted in almost every country, but where many women have unintended pregnancies. The world's lowest abortion rates are in Western Europe, where the procedure is legal and widely accessible, but where effective contraceptive use is high and unintended pregnancy rates are low. The way to reduce abortion is not to outlaw it, but to help women avoid unintended pregnancies in the first place. In the developing world, 222 million women want to avoid pregnancy, but are not using a modern contraceptive method. For many, the limited contraceptive services and methods available do not meet their needs. Others lack access to family planning services altogether. And some women need better counseling and more power to make their own childbearing decisions. If these women's family planning needs were met, the results would be dramatic. Unintended pregnancies would decline from 80 million to 26 million annually. And there would be 26 million fewer abortions each year. Most importantly, thousands of women's lives would be saved. Making abortion illegal does not stop it from occurring. It just drives it underground. Women are then forced to seek risky procedures, often performed by untrained providers or under unsanitary conditions. And many even try to perform abortions on themselves. The consequences can be horrific. Unsafe abortion is a leading cause of maternal death. Every year, 47,000 women die from complications of unsafe abortion. Virtually all of these deaths occur in countries with highly restrictive abortion laws. And millions more are injured, some seriously and permanently. This is a public health crisis that must be addressed. Ensuring that women have access to medical treatment after an unsafe abortion, if needed, is essential to reducing maternal deaths and injuries. But it is only one step. In every country, even those with the highest levels of contraceptive use, there will be a need for abortion. It's the basic right of every woman to make her own decision about whether and when to have a child, without having to put her health or her life at risk. It is time for all countries to make that right a reality.
Well, the pregnancy is removed from the womb either by taking pills, medical abortion, which involves taking medicines to cause a miscarriage, or by surgery, surgical abortion, where the pregnancy is removed from the womb. Most abortions can be provided on a day-care basis, which means you do not need to stay at clinic overnight.
The patient is being prepared for the procedure. The Ethoscope, the fiber optic instrument through which we will observe this abortion, as it begins in a swirl of blood. The forearm. Note the blood vessels running under the delicate skin. The hand and the fingers. This thick blue coil structure is the umbilical cord. This is the child's lifeline to the mother. This was a little boy. The ear is readily identifiable. It has been shown that in the later months of pregnancy, the child will react to sound. The nose. Here is the mouth. This little fellow can be seen swallowing water. The eyebrows. The eyelids are still closed. These are the tools of the abortionist's trade. In a few months, this little boy's life will be summarily extinguished with these instruments. The cervix has been sufficiently dilated, and the bag of water is broken.
And now we can see the process.
Guided by ultrasound, the abortionist grabs the baby's leg with forceps. The baby's leg is pulled out into the birth canal. The abortionist delivers the baby's entire body, except for the head. The abortionist jams scissors into the baby's skull. The scissors are then opened to enlarge the hole. The scissors are removed and a suction catheter is inserted. The child's brains are sucked out, causing the skull to collapse. The dead baby is then removed.
If you are under 18 years old, your state may require one or both of your parents to give your permission for your abortion or be told of your decision prior to the abortion. However, in most states you can ask a judge to excuse you from these requirements. Thank you very much.